The state Supreme Court wasted little time this week in striking down a cigarette fee, ruling the measure passed in the final days of the legislative session was unconstitutional. The High Court's decision will force lawmakers to either find a new revenue stream or to make massive cuts to services which impact thousands of Oklahomans.
It was apparent during Tuesday's oral arguments that Oklahoma Supreme Court justices were skeptical of the state's arguments supporting Senate Bill 845, the cigarette fee. The court's newest member, Justice Patrick Wyrick, who wrote the court's opinion, left little doubt during Tuesday's hearings that the fee sounded more like a tax.
Black's Law Dictionary defines a sin tax as an excise tax imposed on goods or activities that are considered harmful or immoral, such as cigarettes, liquor, or gambling. How is that not what this is?
Attorney Robert McCampbell, arguing on behalf of tobacco giant Philip Morris and others, claimed there was no question about the bill's intent.
Senate Bill 845 is plainly a revenue bill. It levies an excise tax, $1.50 per pack, on cigarettes. It will raise $225 million per year. That money is used to support government operations.
Oklahoma Solicitor General Mithun Mansingani countered by claiming the bill was a public health measure designed to reduce smoking.
Without this bill, 18,000 more Oklahomans will die prematurely from smoke inhalation. And that doesn't sound like a revenue bill to me. That sounds like a public health measure.
Mansingani also argued the bill was not a tax, but a fee, since the money would go into a special health care fund rather than into the general revenue fund.
Petitioners cannot deny that the state exercises legitimate police power when it attempts to reduce smoking rates to benefit public health. Petitioners also cannot deny that the most effective policy to reduce smoking rates is to impose a fee to raise cigarette prices.
But Justice James Edmondson threw doubt on the claim that the fee was primarily designed to protect public health, noting that the revenue generated by the fee does not go specifically to programs to curb smoking.
It is not specifically targeted to people with emphysema, say, or a heart disease, and you even exempt veterans centers, probably out of a fear of mutiny. But, the specificity seems to be lacking in this, and it does, therefore, take on every appearance of being a revenue-raising bill for government.
The tobacco measure would have provided more than $200 million for the Oklahoma Health Care Authority, the Department of Human Services, and the Oklahoma Department of Mental Health and Substance Abuse Services. Oklahoma Policy Institute Executive Director David Blatt says with the bill being ruled unconstitutional, lawmakers will have little choice but to return to the Capitol to address the ensuing revenue shortfall.
I don't think there's any alternative but for the governor to call the legislature back into special session in order to find another way to raise revenues that would avoid devastating cuts to key services serving the elderly, individuals with disability and mental health, and children.
Legislative leaders reacted quickly to the ruling. House Minority Leader Scott Inman issued a statement urging Governor Fallin to call for a special session and for Republican leaders to come together with myself and Senator Sparks and draft a truly bipartisan and constitutional budget plan that will help to restore, reinvest in, and rebuild Oklahoma. Senate President Pro Tem Mike Schultz also released a statement saying, "While I disagree, I appreciate the Oklahoma Supreme Court's quick ruling allowing the governor and legislature to immediately address the matter. There are several options available to us, and Senate leadership will continue to work with the governor's office and House on deciding the best move forward." And Governor Mary Fallin issued a statement announcing her plans to discuss the ensuing shortfall with legislative leaders, saying agencies and the people they serve cannot sustain the kind of cuts that will occur if we do not find a solution. My belief is we will have to come into special session to address this issue.